In 1920, the member states of the Pan American Health Organization recognized the need to exchange health information to deal more effectively with the important diseases of the time, which were affecting many countries. Shortly after, the Pan American Health Bulletin was launched. The first issue of the bulletin was published in 1922. It presented a list of cases and deaths from contagious diseases, an analysis of the importance of cooperation between countries, and recommendations on how to, and the word they use is extirpate, meaning eliminate smallpox. Thus began the exchange of scientific information in support of public health systems in the Americas. The choice of topics was related to the health problems of the time: cholera, yellow fever, smallpox, and tuberculosis, none of which respected borders, races, ages, or socioeconomic classes. Even 100 years ago, the topics covered in that first issue of the bulletin, which today bears the name of the Pan American Journal of Public Health, sought to promote regular scientific communication between health authorities in the region. Over time, the initial focus on older diseases such as leprosy and smallpox gave way to other infectious diseases, some of them new, such as HIV and COVID-19. Also non-communicable diseases, health systems, and other health issues of regional interest. In 2021, the journal begins its 100th year of uninterrupted publication. During this century, the format and content of the journal have evolved with the times, and it is currently published free of charge in 3 languages: English, Portuguese, and Spanish, to promote access to information in countries of the region. New technologies have brought the journal online, providing timely and relevant scientific evidence to support decision-making. Since our first issue in 1922, the journal has emphasized the importance of international cooperation, which continues to be necessary to prevent the transmission of diseases with global impact. Timely communication of sound scientific evidence is the basis for making appropriate health decisions. At the same time, information is now disseminated more widely and quickly than ever through social networks and other platforms. Today, we are also confronted with disinformation and fake news, threatening the sustainability of health strategies and putting the health of the population at risk. The journal's daily work contributes to evidence-based decision-making during the crucial time of COVID-19, when scientific research is key to combating the pandemic and occupies a strategic place in the agendas and priorities of the countries. In 2022, in addition to celebrating the journal's 100th anniversary, we will also celebrate the 120th anniversary of the Pan American Health Organization itself, whose many achievements in the field of health at the regional level are reflected in the pages of the journal. So join us in the celebration of this first century of work. We are focused on continuing the scientific legacy of the Pan American Journal of Public Health for another 100 years at the service of the countries, institutions, health professionals, and the people of the region of the Americas.